Hello viewers, welcome to the video lecture series for the job role of Solanaceous Crop Cultivator Class 9th. In this unit, we will discuss about occupational health, hygiene and first aid practices. This unit we have two sessions. Session 1, Prevent hazardous condition at workplace. Session 2, First aid treatment and safety equipment. Let's understand the second session, that is First aid treatment and safety equipment. In this session, we will learn about these topics. First, chemical poisoning and first aid measures. Second, treatment for simple chemical poisoning. Third, safety and protective devices. Fourth, general health and safety measures. So students, first let us understand about the chemical poisoning and first aid measures. Occupational health deals with the control of health hazards that may arise while doing an agricultural work in a farm or a laboratory. It relates to recognizing, anticipating, evaluating and controlling those environmental factors at a workplace which may be a reason of some health issues. So, what is chemical poisoning? Chemical poisoning may result from continuous contact, absorption of a chemical through the skin, inhalation of toxic vapor, or swallowing a chemical directly during handling or applying. The common symptoms of pesticide poisoning are headache, vomiting, nausea, tremors, convulsion, difficulty in respiration, etc. A first aid kit with necessary antidotes should be available at the worksite of all types of poisoning. Students, you must be wondering as to what can be done if chemical poisoning has occurred. Therefore, let's look at the treatment for simple chemical poisoning. For simple chemical poisoning, we'll have to understand the cause of chemical poisoning. Let us look at a few common causes. First, swallowed poison. If poison is taken internally, vomiting must be induced immediately. Table salt or mustard oil in a glass of warm water is given to the victim for intake. Touching the throat internally with a finger or any blunt and hard material will also induce vomiting when the stomach is filled with liquid. The process must be continued till a clear liquid starts coming out, as in case of swallowed chemicals like carbon disulfide, petroleum products such as kerosene or petrol, and corrosive acids or caustic alkalis. Second, skin contamination. Contaminated clothes must be put off immediately. If you feel like itching or there is a smell of a chemical, the contaminated skin must be thoroughly washed with a detergent and clean water. Rapid washing is needed to minimize the intensity of injury. Third, eye poisoning. In this case, the eyes of a victim must be washed with plenty of water, keeping the eyelids open. A delay of few seconds may intensify the extent of the injury. Immediate medical aid must be provided. Fourth, inhaled poison. A patient must immediately be shifted to an open area so that he or she can inhale fresh air. Artificial breathing must be arranged if the patient is unable to breathe. Artificial respiration technique through the mouth can also be used. Now, let's focus on the safety and protective devices used to prevent hazards. Hazards due to pesticide poisoning can be prevented by using protective and safety devices. The various kinds of pesticide poisoning and their first aid treatment have already been discussed. The safety and protective equipment essentially consists of gas mask, gloves, shoes, eye shields, headgear, protective clothing, respiratory devices, etc. First, gas mask. It is a device to protect the eyes and the respiratory tract from toxic gases and aerosols. It gives clean air to the operator by removing contamination from the air by using a filter or a bed of absorbent material. Second, gloves. Never use gloves made of leather, cotton or any other fluid absorbing material for handling chemicals. Always use rubber gloves. third, shoes. Shoes made of rubber or any other synthetic material must be used instead of leather or canvas shoes. Fourth, eye shields. These must be worn to prevent eye poisoning due to pesticides. Fifth, protective clothing. Apron is used while working with treated crops. The skin must be protected entirely. The clothing needs to be washed before reuse. Students, we have reached the last topic of this video lecture, that is the general health and safety measures. So what are they? Let us understand them one by one. Identify what is unsafe or unhealthy. Take required action to solve unsafe or unhygienic issues at the workplace. Ensure the problems are solved and will not recur. Train workers on how to work safely. Design safe work procedure and supervise the workers. Provide a first aid kit and have a person who can administer first aid at the work site. Arrange appropriate safety gear, for example, hats, gloves, reflective vests, etc. for workers. So students, let us summarize the session. The important points that you learnt here are chemical poisoning and first aid measures, treatment for simple chemical poisoning, safety and protective devices, general health and safety measures. Thank you.